Many men notice that their erection is no longer the same, but ignore the signs until the situation worsens. The penis starts to lose strength. Rigidity doesn't last long enough, and confidence fades away. This problem doesn't appear out of nowhere. And there is a simple test that can reveal what's happening. A test that can be done at home in just 5 minutes, capable of indicating whether your erection is still functioning as it should or if something more serious is one. Strength and grip test affecting your performance. This test can provide important answers and help determine whether the difficulty is a reflection of everyday stress or if there is a physical factor preventing your body's response. The best part is that it doesn't require medical exams, consultations, or any complicated procedures. What you're about to learn could be the first step toward regaining your potency and feeling in control of your sex life again. Before continuing, check if you're already subscribed to the channel to follow more content on health and sexual education. If this video was helpful to you, like it so that more people can also access this information. Share your opinion in the comments. Type 1 if you found the topic interesting, or 0 if you have suggestions for improvement. Your participation makes a difference. An erection doesn't happen by chance. The brain plays a fundamental role in this process, acting as the commander that gives the order for the penis to become rigid. Without this command, nothing happens. That's why stress, anxiety, or insecurity can directly affect performance. The mind needs to be engaged in the moment, receptive to stimuli and free from distractions that sabotage the body's natural response. Many men think the problem is in the penis. But in reality, the difficulty may lie in how the brain processes desire and arousal. When a man is relaxed, comfortable, and properly stimulated, the brain sends signals to increase blood flow to the penis, allowing for a firm and stable erection. If these signals are not transmitted with enough intensity, the erection may be weak or not happen at all. This is what happens, for example, when a man is too concerned with performing well and ends up sabotaging himself. The mind becomes so focused on the fear of failure that the body simply doesn't respond. Think of a soccer team. 2 testosterone level test playing an important final. If the players enter the field nervous and insecure, they will miss passes, fail to score easy goals, and ultimately lose. It's the same with erections. Nervousness and self-pressure can impair blood circulation, making it difficult to achieve an erection. On the other hand, when the cause of the problem is physical, such as poor circulation, diabetes, or structural damage to the penis, even if the brain sends the signal correctly, the body may not respond as expected. That's why understanding whether the problem is mental or physical is essential for knowing what to do next. And that's exactly what the home test will help you discover. Do you want to strengthen your sex life and improve your connection in your relationship? In my digital book, Rediscovering Intimacy, Healthy Sexuality, after 60 you'll find practical guidance on reigniting desire, overcoming physical and emotional challenges, and enjoying more satisfying moments. Access the link in the first pinned comment and discover how to transform your love life. Erection loss may seem like a sudden problem, but in most cases it's a gradual process. A man starts noticing small failures here and there, until suddenly he realizes that what used to be natural and automatic now requires more effort. 3. Flexibility. Heart health test. This decline can be related to various factors and understanding. The root of the problem is the first step in solving it. Blood circulation is one of the key elements involved. The penis functions as a blood reservoir that must fill up to achieve the necessary rigidity. If the arteries are compromised, whether due to plaque buildup, high blood pressure, or diabetes, the amount of blood reaching the penis may be insufficient. This makes the erection weak or causes it to disappear quickly. Another factor affecting many men is the natural decline in hormones, especially testosterone. This hormone regulates not only libido but also energy levels, motivation, and erection quality as the years go by. Testosterone levels decrease, making the sexual response slower. This doesn't mean it's impossible to have strong erections in maturity, but it may require lifestyle adjustments or even medical supervision. Beyond physical factors, harmful habits, such as smoking, excessive alcohol consumption, a sedentary lifestyle, and poor diet also contribute to erection weakness. The human body is like a car. If it receives bad fuel and little maintenance, it starts to break down. The difference is that in this case, the engine that fails is one of the most important for men's quality of life. 4. Posture spine health test. Whether due to physical reasons or daily habits, erection loss should never be ignored. And to differentiate whether the problem lies in circulation or brain function, the home test you're about to learn will be a great ally. One of the biggest challenges for those facing erection difficulties is understanding whether the issue is in the mind or the body. That's where a simple test comes in, which can be done at home without the need for equipment, medical exams, or immediate intervention. This test helps identify whether difficulty in maintaining an erection is related to psychological factors or a more serious physical problem. The method involves evaluating the body's response when there are no external pressures, such as performance expectations or the need to please someone else. For this reason, the test should be done in a calm environment, free from distractions or worries. The goal is to create a situation where stimulation is natural and spontaneous. The first step is to choose a visual or mental stimulus that usually triggers desire. It could be a pleasant memory sensory material, or any other resource that works for each person. Next, the man should observe whether arousal occurs spontaneously and if the erection reaches a satisfactory level of rigidity. If the erection occurs without difficulty in this controlled scenario, it indicates that the penis is functioning properly and that the cause of the problem may be mental, usually related to anxiety or fear of failure. But if even in this stress-free environment, the erection is weak or doesn't happen at all, there is a stronger indication that circulation or tissue health may be compromised. This test does not replace a medical evaluation, but it serves as an excellent starting point for better understanding what may be happening and what the next 5. Blood circulation and capillary refill. Test steps should be: the results of the home test provide valuable insights into the cause of erection difficulties. If an erection occurs normally in a controlled environment without external pressures, but fails when engaging with another person, the issue is likely psychological. This happens because the mind can create barriers that hinder the body's natural response. Men who experience performance anxiety or excessive concerns about satisfaction may struggle with erections even without physical problems. On the other hand, if an erection does not occur or remains weak, even when the environment is favorable and the stimulus is adequate, there is a strong indication that the problem may have a physical origin. This could be related to blood circulation issues, reduced hormone levels, or conditions that directly affect the tissues responsible for erection situations, such as diabetes, hypertension, and cardiovascular diseases are common factors in these cases. Additionally, some men notice variations in their test results. Sometimes they achieve a satisfactory erection, but at other times the response is weak. This could indicate a mixed problem where both physical and emotional factors interfere with performance lifestyle, and mental state on the day of the test can also influence the outcome. Although this method is useful for an initial 11 o'clock summary and action steps assessment, it does not replace a professional diagnosis. If the test reveals persistent difficulties, seeking a specialist is the best way to identify the exact cause of the problem and begin appropriate treatment. Regardless of the cause of erectile difficulties, there are effective strategies that can lead to significant improvements in cases where the issue is linked to blood circulation. Lifestyle changes are one of the first steps. Regular physical exercise, especially activities that support cardiovascular health, such as walking, weight training, and cycling, improves circulation and enhances sexual response. Additionally, maintaining a healthy weight reduces insulin resistance and inflammation factors that can impair erectile function. Diet also plays a crucial role. Foods rich in true antioxidants, such as berries, leafy greens, and omega-3 rich fish, help combat free radicals and improve vascular health. Avoiding ultra-processed foods, excessive sugar and trans fats can prevent plaque buildup in the arteries, ensuring proper blood flow for erections. For men experiencing mental barriers, relaxation techniques and anxiety management can make a significant difference. Deep breathing exercises and even meditation help reduce stress and create a mental state more conducive to sexual desire. Additionally, seeking psychological guidance can be an excellent option for those who feel insecure during intimate moments. In some cases, supplementation may be beneficial, as long as it is guided by a professional nutrients such as zinc, magnesium.